Hey guys, welcome to Podiatry Practice Mastery. Don here. Today I'm going to change it up a little bit. Today I'm going to go over one of my most used presentations, and I want to kind of walk you guys through how I use these presentations. Before I did presentations, I found things to be quite complex. I'm going to talk about something that we all see, nail fungus, and kind of how I do it and how I kind of explain it. Not saying that this is the only way. I don't be presumptuous, but I think the best way with showing slides makes it a lot easier. Okay, so that's what I'm going to go over with you guys today. So let me show you. This is my typical web browser. Here are my my tabs up top. So under this tab called Patient Presentations, I have everything that I use all the time. So the most common ones are like my ultrasound, Achilles tendonitis, and things like this. And I'm going to go over my nail fungus one today with you. Just because I've been using it a lot, and I've been trying to tweak it lately because I'm trying to reduce my nail visits to one visit instead of multiple visits. And I want to explain my renditions of what's kind of worked for me, and some of the side hustle things that I've been doing as well with this. Okay, so basically when I pull it up, I'm going to show you guys as if I'm presenting it. Okay, so when I present it here, it's going to show up like this. I sometimes put on this little laser pointer, and this is done with Google Slides. So I say we're going to talk about nail fungus, and I kind of just show them what type of nail that they're having. And then I go over the most common questions. I think it's good getting kind of the elephants out of the room when I'm seeing patients. So I talk about why do I have nail fungus, what causes it, what are the treatment options, will the medication injure my liver, and then will it come back? Those are the most common questions I get. And then I think it's important for us to get kind of what the goal of our patients is for their nails. And because a lot of the older patients, they just don't want their nails to hurt. And so we might not be treating them. Other ones, they want a perfect nail. And so I tell them, is your goal having a normal nail, or is it just having like a less painful, less thick nail? And then specifically, this is something I've learned as I've gone on. What are a few things that you don't do as a result of your nails? This is really important. And this is a key thing even for doing like other cosmetic procedures that we do. So if they're not wearing their sandals because of it, it's going to be a whole year before they get a new nail if the medication works or the other treatments work. So I think if they're not wearing sandals, if they're only wearing shoes, if they're really embarrassed, I think that's something that's a good question to have. And then also kind of the after effect, like what would it be like to do when you have normal toenails, and what are they going to do? Are they going to wear sandals? Like I have a lot of patients that come in, and after they have like the carry flex procedure, they go out and buy like 10 pairs of flip-flops because they haven't worn flip-flops in a number of years. So it's a good thing like that. And then a lot of times I'll tell them, like I'll even like tell them before, like a lot of my patients, they're embarrassed with their nails. Is that how you feel? Just to kind of, so they understand, you understand, and they understand what they're really feeling. The next thing I do is I talk about, do you have nail fungus? I usually say it's usually caused by an organism. If you're unsure, I take a sample of the nail. I pretty much always take a sample of the nail. And I interviewed Mike Baker, if you want to look at that interview a couple of days ago or a couple of interviews before, where you can actually do these tests in your office. I just use this as an example. I do a distal trimming of the nail. I send it off. I actually don't send it in a specimen container. I just do the little packets. And within my EMR, it automatically does that. And then I get a result back. Now, back in the day when I made this presentation, once again, I do this for you guys. I'm explaining to you, but I don't use Baco anymore. I use someone else, but it doesn't matter. Really, I just say that I'm going to get a result in 2 to 3 weeks. And I explain to patients it could come back as a fungus, mold, candida, psoriasis, or thickening from nail or injury. This is how I explain it to them. And I used to see them back in 2 weeks. I'm trying to avoid that 2-week follow-up, especially for real simple things. And I'll tell you a few things I'm trying to do. Next thing is I go over the treatment options: topical, oral, laser, nail resurfacing, or nail removal. Sometimes I remove, like if it's one bad nail, I'll remove it. Nail resurfacing, once again, if they need a cosmetic procedure, because it's going to take a long time to get a new nail. And then these are the 3 options. This is how I explain it. And this is a new rendition. Let me explain this. This is what I call a nail fungus treatment evaluator. I've done this for Achilles tendonitis, for plantar fasciitis. And basically, I put the effectiveness on the outside, most effective to least effective. I go through the treatment options, reducing recurrence, and then improving nail health. And I do a couple of things on purpose. Let me walk you through this. So most effective, I find, is the oral. I don't know what you guys think. If you have a different comment, please comment on the bottom of the video. I find I do still do oral terbinafine. Sometimes I'll do itraconazole or some of these other ones. I do 3 months daily. I see them back in 3 months. Then I see them in 6 months. I do it weekly just to keep a little bit in their system, and just so I get to see them back and make sure they're actually getting better. And I'll do pictures at these, and then 3 months daily again if it's not totally cleared up. I do liver function tests in the beginning, so I usually send them when I review the pathology results, or if I'm not seeing them back anymore, I just print out the prescription for the lab slip. Okay. Laser treatment I do for certain patients that aren't candidates for oral or they don't want to take it. Okay. And then prescription topical antifungal. I don't do a lot of that. I just don't find that it really works for real thick ones. So maybe if it's a light fungus, meaning just a superficial one, you might be able to try it topical. I just don't find them all that effective. I sell one in the office only because it has a money back guarantee with it. Not that I think it works great. Another thing I do sometimes if they're very, very thick and they don't want treatment, I do like a urea cream, urea gel thing on there. Preventing recurrence, I throw out shoes. I always say, we used to have people throw out shoes that got too expensive. So now what I do is a shoe sterilizer and an antifungal spray. And then I also recommend them getting biotin. Okay. So this is how I explain it to patients now. What I used to use, which I think was a little more complex, was this thing. It pretty much says the same thing, but I give like effectiveness rates, what I think are effectiveness rates, and things like that. But I find the less I do, the simpler, the more I do these things, the simpler it gets. And then I do have some other slides where I talk about these things, but I tend not to do these anymore just because it's too complicated. I'm really trying to simplify and do less and less slides and have it just the most important thing. So let me show you. Also within Amazon, I don't know if you guys have this, but there's something called an Amazon, like an Amazon marketplace or something like that. Or recently on Amazon, you can put up videos. My videos haven't done too well because I think they've been too long. I tried to put up some videos on this Amazon thing. Within Amazon, you can do a storefront. So this is a storefront that I did for me. What I have it as based on different diagnoses. And so foot wounds, plantar heel pain, things like that. These are some of the videos that I've uploaded. But the one I was referring to, I'll send my patients a link to this via Patient Education Genius. I've talked about that before. Basically, it's a place where I can send out patient education information, and it gets reviews as well online. So what you'll see here and what patients see is they see the shoe sterilizer. I'm actually switching it and doing one in the office, but this is what I currently do. This is a biotin that I found. This is a shoe spray. Here's some antifungal topical things, and here's some tea tree oil, nail gel, other things like that. I don't push these type of thing. I just have them there on that list in case that people want to go there. If you guys want to see what I do with this, so I send that out to patients, and if they click, then Amazon pays me. I do not make hundreds of dollars unless something has changed. maybe you'll see I'll eventually start making millions. So I make a whole whopping $32, okay, which isn't anything at all, okay. But that's how I'm referring to them, and then they pay a little bit. So anyway, that's what works for my nail fungus. If you guys want to learn more, if you haven't done my 30-day practice blueprint, please do that. I have a couple of my favorite ones in there. I think on plantar fasciitis, and I think my pre-surgical discussion. And then I have a whole course on patient presentations where you can get all my presentations. But I'm just kind of going through these because basically because I'm going on vacation next week, and I can't think of anything else today. So until next week, please give me your thoughts. Shoot an email back. Love to hear what you guys think. Okay.